Welcome to the Deep Dive. Today we're tackling a really significant topic, brain injury. It affects so many, but it's incredibly complex.
It really is, and we've got this source text just titled Brain Injury, which covers a lot of the fundamental ground.
Right, so our mission today is to kind of pull out the most crucial bits from this text, make it understandable, highlight the key insights, but without getting totally bogged down in every single detail.
Exactly. A clear path through the essentials, definitions, causes, signs, diagnosis, treatment, all based on what's in the source.
Okay, sounds good. So let's start right there. Definitions. How does our source actually define a brain injury?
Well, it kicks off with a really important split. Traumatic versus non-traumatic.
Okay.
Traumatic is what most people probably think of first, an external physical force hitting the head, an impact.
Like a fall or an accident.
Precisely.
Yeah.
But then there's non-traumatic, which comes from internal issues. Things like hypoxia, lack of oxygen, or metabolic problems. Vascular events like stroke, infections, toxins, even tumors.
That makes sense. External blow versus something internal going wrong. The source also talks about primary and secondary injury. What's
Yeah.
that about?
Yeah, that's another key concept. Primary injury is the immediate damage, right at the moment of impact or the internal event.
So like the cells getting stretched or compressed or torn.
Exactly, the initial mechanical or physiological insult, but then you have secondary injury.
Okay.
And that's the stuff that happens after the initial event. It's a cascade, really, of changes in blood vessels and tissues that unfolds over hours, sometimes even days.
Wow. So the first hit is just the start, and the body's reaction can actually make things worse later on.
In many cases, yes. That secondary cascade is often where a lot of the long-term damage comes from, and it's a major target for treatment.
That's critical to understand. So let's dig into the why a bit more, of the pathophysiology. What's actually going on inside the brain?
Well, mechanically, the source mentions forces like rapid acceleration, deceleration, rotation. These can physically disrupt the brain tissue.
It makes sense, the brain moving inside the skull.
Right. But beyond the physical forces, the brain is incredibly hungry. It needs a ton of oxygen and glucose constantly.
More so than other organs.
Much more relative to its size. So any interruption in oxygen supply, hypoxia, makes it extremely vulnerable very quickly.
And oxygen gets there via blood flow, right? Cerebral blood flow.
Exactly. CBF is king.
Yeah.
And CBF depends on something called cerebral perfusion pressure, or CPP.
Okay, CPP, how does that work?
There's a formula the source gives. CPP equals MAP ICP.
MAP, mean arterial pressure.
Yep, your average blood pressure. And ICP is intracranial pressure, the pressure inside the skull.
So CPP is like the effective pressure pushing blood into the brain, overcoming the pressure already inside.
That's a great way to put it. It's the pressure gradient driving flow. But when the brain's injured, things can mess with that balance.
How so? What increases that ICP, the pressure inside?
Several things. Bleeding inside the skull is a big one. Swelling, or edema, the source mentions two types, vasogenic and cytotoxic. Also, problems with blood vessels dilating or spasming.
And if that ICP goes up and stays up, that's bad news.
Very bad news. High ICP squeezes the blood vessels.
Reducing the blood flow, the CBF.
Right, which leads to ischemia, not enough blood supply. That causes more swelling, more pressure. It's a vicious cycle. It can even lead to herniation.
Herniation,
Yeah.
where the brain tissue actually gets pushed out of place.
Yes, push into compartments where it doesn't belong. Extremely serious. Interestingly, though, the text notes that if the ICP increases slowly, the brain seems to tolerate it a bit better than a sudden, sharp rise.
Like it has some time to adapt, maybe?
Perhaps, yeah. Some compensatory mechanisms might kick in, but rapid increases are very dangerous.
The source also flags hypotension, low blood pressure, and hypoxia as major drivers of that secondary injury we talked about. Why them specifically?
Well, think about it. The brain tissue is already hurt, already struggling.
Okay.
If you then reduce its supply of oxygen and fuel by lowering blood pressure, or directly cut the oxygen with hypoxia, you're just adding fuel to the fire.
Making the secondary damage cascade even worse.
Exactly. That's why supporting blood pressure and oxygenation is so absolutely critical in treatment. We're trying to stop that secondary wave, or at least limit it.
It really highlights how crucial that immediate supporting care is. So this isn't just contained to the head then. Brain injury can affect other body systems.
Oh, absolutely. The source makes that very clear. The nervous system itself is obviously hit hard, altered mental state, cranial nerve problems, seizures, twitching, weird postures.
Right, that's expected. But elsewhere.
Yep. Cardiovascular system, you can see arrhythmias, abnormal heart rhythms.
Wow. even the heart.
Definitely. And the endocrine and metabolic systems can go haywire too. Hormones like ADH might be affected, leading to sodium problems. Temperature regulation can be disrupted. You can see insulin resistance, even cortisol issues.
That's quite a ripple effect. What else?
Eyes are a big one. Changes in eye position or movement, how the pupils react to light, papilledema, which is swelling of the optic nerve you can see at the back of the eye.
And breathing.
Respiratory system, too. You might see abnormal carbon dioxide levels, strange breathing patterns, even fluid buildup in the lungs called neurogenic pulmonary edema. It really shows how interconnected everything is.
It's truly staggering. A hit to the brain can really throw the whole body off balance.
Yeah.
Okay, let's shift focus a bit. Who typically gets these injuries, according to the source?
Well, the text is primarily focused on dogs and cats.
Our companion animals.
Right. And it points out something quite striking. Head and neck injuries are found in up to 34% of dogs and cats that suffer blunt force trauma.
34%? That seems really high.
It is surprisingly common, yeah. It probably relates to things like car accidents, falls, maybe fights, things our pets can unfortunately get into.
That's a sobering statistic. And what about serious complications, like bleeding inside? Hematomas.
The likelihood of those depends heavily on how severe the initial injury was. For mild head injuries, the source says maybe 10% develop these hematomas bleeds within the brain tissue or between the brain and skull.
Okay, but for severe injuries?
That number jumps dramatically, up to 80% in severe trauma cases in dogs and cats.
80%?
Yeah.
Wow. So clearly a major issue for pets. Now the really practical part, spotting the signs. What should someone look for?
The source breaks it down nicely. History, physical exam, and then the specific neuro exam.
Okay, let's start with history. What background info is important?
Crucially, trying to figure out the cause. Was it trauma? Or could it be something internal, like a heart issue, seizure, toxin, high blood pressure?
So asking the owner lots of questions.
Absolutely. And a really key piece of history, the source stresses, is any decline in the animal's neurological state over time. That's a huge red flag.
Suggesting things are getting worse inside, like swelling or bleeding.
Exactly. It points towards ongoing secondary injury. Also noting if there have been seizures is important. That often points towards the higher brain centers, like the cerebrum.
Makes sense. And then the physical exam. What might you see just looking at the animal?
Obvious signs of head trauma, of course, wounds, bleeding from the nose, epistaxis, blood in the ears. But also looking for signs of underlying problems, difficulty breathing, bluish gums suggesting low oxygen or cyanosis, signs of poor circulation like weak pulse or pale gums.
Checking the whole animal, not just the head.
Right. You also need to carefully feel the skull for any fractures or abnormalities. And interestingly, a persistently slow heart rate, bradycardia, can sometimes indicate a problem deep in the brainstem, midbrain, pons, or medulla.
A slow heart rate. That seems counterintuitive.
It can be part of something called the Cushing's reflex. That's slow heart rate plus high blood pressure. It's a classic ominous sign of rising intracranial pressure.
Okay. That combination is the key. What else on the physical?
Looking for bruising, tiny pinpoint bleeds called petechia, maybe checking the eyes for signs of high blood pressure or clotting problems. And that papilledema we mentioned, the optic nerve swelling, is a big one suggesting brain edema, sometimes even retinal detachment.
So a thorough physical can pick up lots of clues. And then there's the specific neurologic exam. That must really help narrow things down.
Definitely. This is where you assess brain function directly. You look at the level of consciousness. Are they alert, dull, stuporous, comatose? And you test all the cranial nerves.
And that helps locate the damage.
It can, yes. Is the problem mainly in the cerebral cortex that often has a slightly better outlook? Or is it deeper in the midbrain or brainstem, which is more critical? Or is it widespread, multifocal?
Are there other indicators of location?
Certain postures can be very specific. Decerebrate rigidity, stiff legs, arched back, or decerebellate rigidity point to damage in particular brain areas. And if the signs came on super suddenly, peracutely, and are focal, that might hint at a stroke or maybe a tumor.
You mentioned cranial nerves. And pupils seem important too.
Yeah.
How they react to light.
Hugely important. Pupil responses give you immediate clues. Are they small, myotic, but still reactive? That might suggest cerebrum or diencephalon issues, though you have to rule out eye problems too.
What about other responses?
Pinpoint, unresponsive pupils often point lower down diencephalon, pons, medulla. And the really worrying sign is dilated, fixed pupils or midpoint fixed pupils. That strongly suggests a midbrain lesion, which is very serious.
It's amazing how much info you can get from that simple reflex. And you said other cranial nerve deficits help localize too.
Absolutely. If cranial nerves seem okay, but the animal's mentation is off, the problem might be higher up, cerebrum or diencephalon. Losing specific reflexes like the menace response or having abnormal eye movements like nystagmus can point towards the forebrain or brainstem.
And deficits in specific nerves.
Yes. Problems with nerves there or V through 12 can help pinpoint lesions within the midbrain, pons, or medulla pretty precisely. It's like following a trail of clues.
Even breathing patterns can give clues. That's
Yeah.
wild.
It is. Certain patterns are linked to certain locations. Jane Stokes breathing that cycle of deep, then shallow, then pauses might mean widespread cerebral or diencephalic damage. Constant hyperventilation could be midbrain, really irregular, disorganized breathing, or breathing with long pauses at the peak. That points towards the pons or medulla, the lower brainstem.
Like the brain's distress signals manifest in breathing.
Yeah.
Okay, so we know what it is, how to spot it,
Mm.
what actually causes brain injury. The source listed quite a range.
It's a very long list. Trauma is the obvious one, falls, accidents,
Right.
but also lack of oxygen for prolonged periods, shock, severe low blood sugar, seizures that go on too long, extremes of body temperature too hot or too cold.
Internal factors again.
Yes, exactly. Also, big shifts in blood concentration, what we call osmolality, toxins, brain tumors, high blood pressure, bleeding in the brain,
Yep.
infections or inflammation, even things like thiamine deficiency, hydrocephalus, or parasites migrating to the brain.
That covers a huge spectrum. Is there a common thread? What makes the brain so susceptible?
I think it comes back to that intense need for oxygen and glucose and its reliance on a very stable internal environment. It just doesn't tolerate disruption well.
Are there specific risk factors mentioned? Things that make an injury more likely?
Yes, a few. Free-roaming animals are definitely at higher risk for trauma and toxins.
Makes sense.
Having underlying health issues, heart disease, breathing problems, clotting disorders, liver disease makes animals more vulnerable too. And the source notes diabetes, especially if the pet is on insulin, as a potential risk factor, possibly due to risks of hypoglycemia.
Okay, so diagnosis involves piecing all this together. What does that process usually look like?
Well, first you have to rule out other things that can look like a primary brain problem.
Like what?
Metabolic diseases, toxins, certain drugs, infections elsewhere in the body, even some inner ear problems. After the physical and neuro exams, lab tests are key.
Blood work.
Yep. CBC, biochemistry, urinalysis. These check for systemic issues, electrolyte problems like sodium changes, which can happen with brain injury. Arterial blood gases tell you about oxygen and CO2 levels. Coagulation tests check for bleeding risks, maybe tests for specific infectious diseases too.
And then imaging, I assume,
Yeah.
to actually see the brain.
Absolutely critical. Skull x-rays might show fractures, but they're limited.
So CT or MRI.
Exactly. CT scans are great for seeing acute bleeding, skull fractures, sometimes strokes, foreign objects, hydrocephalus, or herniation.
And MRI.
MRI gives even better detail of the soft tissues. It's excellent for picking up swelling, edema, different stages of hemorrhage, tumors, inflammation, subtle herniation, even some fractures CT might miss.
Was there anything else?
The source mentions using ultrasound on the optic nerve. If the nerve sheath diameter is over 3 millimeter, it might suggest increased pression and edema. It's non-invasive, which is a plus.
That's interesting. Any other diagnostic procedures?
An ECG is good if you suspect a heart link. Blood pressure monitoring is essential, obviously, for checking perfusion. And sometimes, if the cause is still unclean and it's safe to do so, meaning ICP isn't thought to be sky high, a CSF tap might be done to check the spinal fluid for inflammation or infection.
Okay, so if you could look directly at the injured brain tissue pathologically, what would you see?
You'd see evidence of the damage, swelling, inflammation, signs of herniation, bleeding, maybe hydrocephalus, areas of dead tissue from lack of blood flow, infarction, cuts or bruises on the brain tissue, hematomas, skull fractures. On a microscopic level, cell death like necrosis and apoptosis.
A grim picture. All right, let's pivot to treatment. What are the main goals when managing these cases?
It boils down to a few key things. Maximize oxygen delivery and ventilation. Support blood pressure to ensure good cerebral perfusion pressure. Actively decrease intracranial pressure if it's high. And if possible, reduce the brain's metabolic rate, its energy demand.
Okay, core goals. How do you achieve those in practice?
Well, maintaining blood pressure is job one. Keeping systolic pressure above about 90 millimole Hg is often the target to support that CPP. Managing CO2 levels is vital too, usually keeping it in a specific range because CO2 affects brain blood flow.
And oxygen.
Absolutely essential. Oxygen supplementation is standard. The source mentions being careful during intubation or placing oxygen lines to avoid things like coughing or sneezing that can spike ICP. And crucially, never compress the jugular veins in the neck that blocks blood outflow from the head and raises ICP.
Makes sense. What if the patient can't protect their airway?
If they've lost their gag reflex or a tracheal intubation is usually needed.
And general nursing care must be
Oh,
intense.
absolutely vital, especially for severe cases. Careful fluid therapy is key. You need to support blood pressure, but avoid giving too much fluid, which can worsen brain swelling. Sometimes small volume resuscitation is used.
What else?
Positioning is important. Elevating the head slightly, maybe 30 degrees, can help ICP. Keeping the airway clear with suctioning if needed, humidifying air is intubated. Eye lubrication is critical if they aren't blinking. Frequent turning to prevent sores and lung issues. Keeping them clean, managing temperature, monitoring hydration and electrolytes. It's intensive.
And eventually rehabilitation.
Yes, once stable, rehab exercises become important for regaining function.
What about feeding?
Nutritional support is started early. The injured brain needs fuel. Often start with trickle feeding, small amounts frequently, and increase as they tolerate it.
It sounds like owners need a lot of support and education too.
Definitely. They need to know that signs might worsen before they get better, and recovery can be slow, potentially months for residual deficits. And that other health problems can complicate things. It's a long road sometimes.
Is surgery ever needed?
Sometimes, yes. For things like depressed skull fractures pressing on the brain, or if there's a foreign object. Also, if medical management just can't control dangerously high ICP, surgery might be needed to drain CSF, remove a blood clot or mass, or relieve pressure from herniation.
Okay. And medications. The source listed quite a few. What are the main types used?
Meds are crucial. For high ICP, after ensuring blood pressure is okay, you might use hypertonic saline salty fluids to draw water out of the brain. Or diuretics like mannitol or sometimes furosemide. Mannitol is potent but needs careful monitoring.
What about steroids?
The source indicates glucocorticosteroids generally aren't very helpful for acute traumatic brain injury, unlike some other neurological issues.
Okay. Other meds. Pain relief. Sedation.
Yes, pain control is important. Fentanyl, maybe with lidocaine. If the animal is thrashing or seizing, sedatives like diazepam, midazolam, or propofol might be used, but you have to watch out for low blood pressure with those and might need intubation. Levetiracetam is a common anti-seizure drug.
And you mentioned reducing the brain's metabolic rate.
Right. In very severe cases, you might use drugs like dexmedetomidine for heavy sedation or even induce a coma with pentobarbital or propofol. That requires full life support, though ventilation, intensive monitoring.
Wow. Anything else?
Therapeutic hypothermia controlled cooling is sometimes used if started very early. Managing blood sugar is important. Drugs to help gut motility if they're being tube fed. Sometimes desmopressin for severe sodium imbalances, though dosages aren't fully established for emergencies.
It really is a complex balancing act. Are there meds to generally avoid?
Yeah, things that could cause big swings in blood pressure, either high or low, or drugs that might make the brain more excitable or increase its metabolic rate unnecessarily.
And general precautions during treatment.
The big ones are avoid hypotension, avoid hypoxemia, avoid severe hypertension, avoid big swings in glucose or sodium, keep the head and neck positioned properly to help blood flow out. Be careful with diuretics and hypertonic saline not to cause dehydration or low blood pressure. Keep CO2 in the target range. Don't hyperventilate excessively for too long.
So constant monitoring is key.
Non-stop. Frequent neuroexams are number one. Any worsening needs immediate action. Continuous BP, blood gases, pulse oximetry, end-tidal CO2, glucose, ECG, the works. Sometimes even direct ICP monitoring with a probe.
How about prevention? What does the source say?
Pretty basic, but important. Keep pets confined or leashed. Reduce the risk of trauma in the first place.
Makes sense. Sadly, complications can still happen, right?
Unfortunately, yes, the list is long. Seizures, more bleeding, worsening neurosigns, malnutrition, aspiration pneumonia, lung fluid, eye ulcers, skin problems, airway issues, heart problems, electrolyte problems, respiratory failure, permanent deficits, and, well, sometimes death.
It really drives home the seriousness. So finally, prognosis. What influences recovery?
It varies a lot. Younger animals often do better. If the initial injury wasn't too severe and it's mainly swelling, prognosis might be better. A good sign is if they don't get worse neurologically in the first 48 hours. Getting blood pressure up quickly and avoiding low oxygen are also positive factors. The source mentions the Glasgow Coma Scale as a tool for assessment and prognosis, though doesn't detail it.
Okay, so wrapping this all up, this deep dive really shows brain injury as this two-phase process, the
Yeah,
initial hit and then that secondary cascade.
exactly. And recognizing the signs early, understanding what's going on physiologically, that's all crucial for treatment, which is really about supporting the brain and trying to head off that secondary damage.
We hope this overview, pulling from our source, has given you a clearer, manageable understanding of this complex topic. Yeah, hopefully a good distillation of the core information without getting lost in the weeds.
And maybe a final thought to leave you with. We talked about how brain injury affects the whole body. So, flip that around. How might other underlying health issues, maybe things that seem unrelated, actually make someone or an animal more vulnerable to getting a brain injury in the first place or affect how well they can recover? Or, given all the different ways brain injury can happen, what are the biggest challenges in actually preventing it across the board? Something to think about. Thanks for joining us for this deep dive.